This is Dr. Jay Hartley at the Hartley Chiropractic and Scoliosis Center in St. Augustine, Florida. And today we're going to answer a common questions patients give us almost every day, and that is, should I use ice or heat? Well, in the olden days, people were told if I had a new injury, I could do ice 30 minutes on, 30 minutes off. After the first few days, then you could use heat, and really it was as much heat as you wanted to use. Now we know that there's a better way to do it. Whether it's a new, old injury, you want to go with ice. If it's a new injury, inflammation is created, swelling, and you want to reduce that down to control and get better healing. Now there's something called the Lewis-Hunting reaction. What that means is the first 20 minutes, fluid is pulled away from the area, so we're reducing swelling and inflammation. After that, the body realizes that that area of the body has gotten cold, and then it pushes fluid into the area. So we don't want to use the ice longer than 20 minutes. Now that process resets itself in 2 hours. So 2 hours later, then you can do the ice again, and that's going to be the most effective way to use ice. Now let's talk about chronic injuries. Well, chronic injuries get what's called the chronic pain cycle. Part of that is inflammation. So even though it's an old injury, we still have chronic inflammation. So think about this. When you have a baseball pitcher finishes throwing 9 innings, he comes out of the game, the first thing they do is put an ice pack on there. If we have a basketball player that's getting up there in age and they come out of the game toward the end of the game, you'll notice they wrap ice packs around their knees, right? Even though they have chronic injuries, they're using ice to help that chronic injury. So ice is going to help break the pain cycle, and it's going to reduce chronic inflammation. If you use heat, then that can actually spur on the development of scar tissue and more inflammation. So the heat might feel better when you're first using it. So like if you can't fall asleep, you're a little aching, you put a heating pad underneath your back, it allows you to sleep. But then over a period of time, your back pain just doesn't go away. So it feels better when you use it, but you get more chronic pain, scar tissue, degeneration, inflammation. So it's always safer just not to use heat. I'm going to go over the ice pack. So at the office, we've had these nice custom-made ice packs. We also have sleeve covers. You always want to make sure that you cover the ice pack in something between the ice pack and your skin, because you can get freezer burn. So these are some nice sleeve covers. You take the ice pack out of the freezer. Don't freeze the ice pack with the sleeve cover on it. That'll defeat the purpose. So you take the ice pack out of the freezer, put the nice sleeve cover on, then you can use the ice where we've instructed you to do, and this will give you the protection. You'll lay down for 20 minutes, and then 2 hours later you can do it again. All right? So this has been Dr. Jay Hartley at Hartley Chiropractic and Scoliosis Center, and go out there and have yourself a great day.